And I'm going to again ask everyone, please wait your turn and let us do this. We're getting more vaccine every week. It will be everyone's turn soon.
They sent these vaccines for this community, not for Beverly Hills.
And we know that the COVID pandemic has disproportionately impacted certain communities across the state. And we know in Los Angeles County are areas that are lowest income, where housing is more crowded, where people are working in essential occupations where they face risks of COVID. We've seen much more infection. And so those populations certainly need to be prioritized for vaccination.
The top 10 communities with the highest case rates have some of the lowest vaccination rates, an average vaccination rate of about 10%, with a range from about 6.5% to about 15%. When you compare this with communities that have the lowest case rates, that have really had the least number of people infected with COVID-19, you see that the percent of people vaccinated in these communities is far higher, an average of almost 22%, with a range from about 17% to 28%. Our most under-resourced communities in LA County have historically and currently seen the most cases, hospitalizations, and deaths.
It's challenging for us because the state's appointment system, the registration system to be vaccinated, it doesn't allow us at this point in time to just only accept people from a neighborhood where the vaccination site is located to be served. It really opens up appointments to virtually anybody in the county. We hope to correct that over time. So we're taking a lot of extra efforts, I think, to improve the situation. So for example, we know that the online registration system is difficult to navigate for some people. And so we're working with community organizations in these underserved areas to bring in their clients and to actually help them register. And we're letting the community organization know exactly when appointment slots will open up so that their clients can get an advantage in terms of getting an appointment. In addition, we're providing transportation assistance to folks who may not be able to easily get to a site that's further than walking distance. And then finally, we're also making sure that we have our appointment systems and all of our materials in multiple languages so that people who are not native English speakers won't have language as a barrier. So I think this vaccination rollout has demonstrated about as vividly as it could be demonstrated what the impact of privilege really is. I mean, it's been very significant. It's been incredibly frustrating for us to see this, but people who have more means can spend more time trying to navigate and get an appointment online. They may have more skill in dealing with the internet, more ability to take time off from work to try to get an appointment. The language barriers aren't as significant. The transportation barriers aren't as significant. And probably, I think, most telling is that these groups with privilege have more social connections. They're, through word of mouth, able to find opportunities to kind of bend the rules and sneak in and sort of get vaccinated, whereas people in the more disadvantaged communities don't have that. And so it's really imperative that we counter that and do everything possible to create opportunities for those in the communities that have been hardest hit by the pandemic to have their fair share of vaccine, and even more, because they're the groups that are at greatest risk and will receive the greatest level of protection from the vaccines. I mean, ultimately, we want everybody to be vaccinated, but as we're rolling out this vaccination campaign, we really have to do a better job, I think, of reaching those that have historically been very disadvantaged. We, for years, decades, have seen very stark inequities in health across these populations. And this is a very well-defined service that we're providing, vaccination, and we should be able to do a much better job of making sure that we get those groups that could benefit most to be vaccinated.